Hi, Erta. Thanks for joining us today on the Wellness Webinar Series. How are you doing?
Hi Nick, I'm doing fine. How are you?
Good. Yeah. If you could please just go ahead and just introduce yourself to all the viewers and just tell us about um, where you are in your studies and what projects that you're working on.
Sure. My name is Erta Cenko. I am a Ph.D. student in the Department of Epidemiology, second
Mhm.
year. My focus usually lays on diseases that affect older adults, like
Okay.
Alzheimer's disease and other dementias. But I'm looking at these dementias from another point of view that is not very usual. So I'm looking how dementias affect mobility and how
Hmm.
mobility in older adults can affect the progress of the disease. So I'm focused on physical activity and wellness, and
Hmm.
how this can improve the life of older adults.
Hmm.
This can delay the onset of their diseases, and
Hmm.
so on. So that's what I'm working on.
Ah, very interesting. So you're looking at the maybe possible benefits of physical activity after somebody has been diagnosed.
Yes, after, but also I'm looking at individuals who are genetically predisposed to have a disease.
Hmm.
I'm trying to see how physical activity affects the onset of disease. It is
I
thought
see.
if you are engaged in physical activity, your onset of disease is later than people who are sedentary.
Oh, wow. Even with that genetic predisposition.
Yes,
Fascinating.
yes, that is really fascinating.
Right. So, yeah, I have a lot of different questions. We go in many different directions. But so as we are recording this on May 1st, 2020, we're in the middle of the pandemic. So how has your research kind of been affected through all of this?
Well, it has. We see participants at the Institute on Aging, where I'm also working
Mm-hmm.
my PhD, and we have stopped the recruiting, of course, because our participants are mostly older adults, and that is a group that is more affected from the pandemic. So we
Right.
um, totally stopped our recruiting, and that
Mm-hmm.
stalls us back, but there is a lot of other things to do, like analysis and
Mm, oh, sure.
for when we come back, because of course the pandemic is gonna end, even though
Mm-hmm.
it's now like it's been a long time.
Sure.
We are preparing for when we go back.
Oh, sure.
Also, I am engaged with the pandemics itself.
Okay. Yeah, yeah, I think that's a good segue. So tell us how you're involved now with the pandemic.
So the Department of Health in Alachua County has been doing contact tracing, which
Mm-hmm.
is logic in any pandemic or epidemic,
Mm-hmm.
to map all the cases and their contacts and trying to lower the curve of the epidemics. So
Mm-hmm.
they have engaged epidemiologists to help with the contact tracing, and I'm
Mm-hmm.
one of these people. So I am engaged in contact tracing of
Mm-hmm.
COVID-19 cases.
Sure. So how long have you been a contact tracer now?
For about 2 months,
Two
almost.
months. Oh, wow, you've been going at it for a while.
Yeah.
Did you have a previous background in tracing?
Yes. I had about 2 years of experience in tracing.
Oh, wow.
I am Albanian, and
Mm-hmm.
um, the Institute of Public Health in Albania has been doing some contact tracing for some epidemics in Albania. One was HIV epidemic, and
Mm-hmm.
the other one was gonorrhea. So I had some experience with.
Oh, wow. That's interesting. I've spoken with a few students prior to our discussion today. So for some students, this is a brand new experience, but for you, this is something that you're very well trained in and have a lot of experience with. So also being an international student working in multiple countries now, what has anything kind of stood out to you as far as contact tracing between countries and tracing between diseases now?
So, despite having an experience, it's always exciting to do contact tracing because it's
Hmm.
epidemiology is what
Right.
called real epidemiology.
Right.
It is fascinating and something that is different with COVID-19 from other diseases, at least the ones I have been involved with contact tracing, is
Mm-hmm.
everyone is more informed now. So
Oh, right. Yeah, that's a great point.
contacting people, yes, and they ask you, for example, is anosmia normal? Because I have lost my senses, and that hasn't happened before, at least in my work. No one has
Sure.
misinformed, and it's good to see that everyone is informed and everyone is following the rules.
Yeah, that's an interesting perspective. To think about whenever you're on the phone with individuals that have tested positive, and then you're kind of going down their contact tree. That yeah, everybody is right. It's a pandemic, so everybody's very well informed, and that has to be encouraging on your end when you're speaking with people.
It is. It's encouraging to see that everyone is informed. It is encouraging to see that everyone is following, almost everyone is following
Sure.
isolation rules, hygiene rules. And I get personally the feeling that most of the people are being compliant.
Sure. Yeah. What do you get a sense of? I know it's a kind of a brief, uh, conversation you have with folks, and you're following a protocol to get some answers. Do you get a sense of maybe what people are struggling with after they've been either diagnosed and and tested positive or come in contact?
So I can speak from a personal perspective of what I get as a feeling, and that is that most of the contacts we are speaking with do not have a lot of physical struggling, but the mental health is affected.
Oh, okay.
This change, staying at home, working from home, many
Right.
people unfortunately have lost their jobs and stability.
Right.
A lot of people have lost childcare, so they have kids at home they have to take care for. So it is
Yeah.
a lot of a mental struggle that
Mm-hmm.
it's hard to deal with these pandemics and with all the changes that we are all facing. But for COVID-19 cases, it's even harder because they
Yeah.
have to deal with the disease and with everything else we are all dealing. So that's the feel I get when I talk to people.
Yeah, so I've never asked this to the other students who do the contact tracing, but if somebody asks you for a resource, for mental health or anything like that, do you have a list of referring agencies that you have ready to give to people or anything like that?
Yeah, so we also send educational information, a lot of links and phone numbers.
Oh, great.
So yes, so the individuals besides our phone call, that is, it's not a short phone call. In
Right.
terms of all the information, educational information provided and assistance provided, uh,
Right.
in terms of how to deal with COVID-19, but we also send an email with some links from CDC and a phone number. So once you click on these links and you go on CDC page, there are some resources to direct you on how to deal with this from the perspective of mental health.
Sure. So you've been contact tracing now for 2 months, and the semester's just wrapping up now. Are you planning to continue with tracing over the summer and fall?
Yes.
Yeah.
So as long as there will be cases to trace, I'm
Oh, sure.
involved with
Yeah.
it.
Is there currently, it's the end of the week, is there a long list of people to get through, so to speak, or is it just vary day to day, week to week? What's
So
kind of the
we
demand
try.
there?
Sorry. So we try to contact the cases and wrap up the cases case by case. We uh, have the luxury to wait and let it be a list. So we get into it fast, and as soon as we get a case, one of the volunteers or one of the DOH people call the case. So we don't have a list actually, but we get cases and get into work soon.
Sure, yeah. So now as a second year student and you've been tracing now for 2 months. What has been the most difficult part of this for you, transitioning into a new role? So you're a student, you're a researcher, now you're a public health worker. So what has been the most difficult part for you through all of this?
Well, time-wise, it has been hard to find spaces. It can be a time-consuming process, and as a second-year PhD student, I'm also preparing for my preliminary exam and involved with teaching as a teaching assistant this past semester.
Wow.
So it's a little bit challenging in terms of finding the time to engage to this, but as I was mentioning before, it's exciting, it's fascinating to be able to do groundwork. So, I'm happy to do it.
Sure, yeah. So as we're the university officials are, we just got the email this morning that they have plans, for summer and fall, and those may change. Getting back to your own research, again, if you're specifically targeting older populations who we know are more vulnerable to COVID-19, do you see any opportunities to maybe experiment with new research protocols? I don't know if I'm just kind of thinking out loud here. Maybe you have, if you're looking at mobility in patients, maybe you have, I imagine you work with them face to face, so maybe there's a glass barrier or a wall. I'm just thinking out loud. Do you anticipate any new research questions to address through all of this?
So as part of my research, I have been experimenting with smart tracking devices.
Oh, okay.
Watches, accelerometers, GPS devices. So one way to conduct my research would be not meeting participants, but providing them, following the protocols, of course, devices, smartwatches, track their mobility and to assess pain, because we use smartwatches to assess pain by prompting questions. So, yes, so it would be not hard to work remotely and to conduct the research without actually meeting the participants face to face.
Yeah, that's great that our technology has evolved to its point today that we can keep up a large chunk of our work, whether it's analyses or testing protocols and new formats. So it's very exciting. We are all in one big natural experiment right now. Yeah,
but at least we have the technological resources to do it.
Yeah. And Erta, I think maybe this could be like a good kind of question to wrap up on. So this theme of these webinars is related to, workplace wellness and connectedness. You're a student worker, right? You're a public health worker. What would you say, if you could give like one piece of advice or anything at all, any comments on everything that's happening from your perspective, what would you like to share with people?
So my only advice is to get more engaged in physical activity. It sounds like something we all know, but if you look at the statistics, there's a lot of people who do not follow the guidelines on physical activity, which is 50 minutes per week. And that helps not only with getting in shape and being physically more active, but it helps with mental health too. It helps with the overall wellness and overall well-being. So that is my piece of advice.
Yeah, I think that's a great point there. Me personally, I love physical activity and wellness. That's why I did all my research on reducing sitting in the workplace, so more activity there. So I think you provide a unique insight, from the from the progression of disease kind of standpoint, the epidemiological perspective of looking at Alzheimer's and dementia, things like that. So oftentimes when we think of physical activity, we're thinking of heart health, strong bones, strong muscles, but mental health is just as important. So that's great. So, well, Erta, I know you're very busy, and I thank you for your time. So I appreciate your time on today's webinar.
Thanks, Nick.
You're welcome.